What if I told you that the way most people try to fix their blood sugar is actually making insulin resistance worse? What if the secret to turning it around wasn't in some expensive medication or trendy supplement, but in your everyday habits, your meals, even the way you move your body? You see, insulin resistance isn't just about diabetes. It silently drives fatigue, brain fog, stubborn belly fat, hormonal imbalances, and even increases your risk for heart disease. And the scary part? Most people don't even realize they have it until it's too late. But what if you could take control today and actually start reversing it naturally? Stick with me, because that's exactly what we're going to explore. Hi, I'm Dr. Nimra Raza. I've spent years studying how hormones, metabolism, and lifestyle factors intersect to impact health. I work with patients who are frustrated with their energy, their weight, and their blood sugar, and I've seen firsthand how simple, evidence-based strategies can make a dramatic difference. Today, we're going to break down insulin resistance in a way that's clear, practical, and backed by science, so you can understand why it happens and what your body actually needs to start reversing it. Here's the thing most people get wrong. Insulin resistance isn't just about sugar or carbs. It's not about weak willpower or a lack of exercise. It's a metabolic signal, a warning light from your cells saying they aren't responding to insulin properly. Think of insulin like a key, and your cells are doors. In insulin resistance, the key still fits, but the door is sticky. Glucose can't get in efficiently, so your blood sugar rises, your pancreas works overtime, and your body stores more fat, especially around your abdomen. And it's not just about weight. Insulin resistance affects your hormones, your energy, your brain function, and even inflammation throughout your body. That's why people often feel tired, crave carbs, or struggle with anxiety and brain fog, and they have no idea that insulin resistance is the root cause. Most advice you hear is surface level. Eat less sugar or exercise more. Those help, yes, but they don't fix the underlying metabolic dysfunction. To reverse insulin resistance, you need a system-level approach that addresses your hormones, your mitochondria, your inflammation, and your lifestyle patterns. Let's break it down. First, we need to understand why insulin resistance happens at the cellular level. Your cells rely on insulin to bring glucose inside for energy. When this process is blocked, glucose builds up in your bloodstream. Over time, your pancreas produces more insulin to compensate. This high insulin environment, also called hyperinsulinemia, signals your fat cells to store more energy, your liver to produce more glucose, and even your brain to crave more food. It's a vicious cycle. Now, why does this happen? There are several key drivers. 1. Chronic inflammation. Inflammation is one of the main culprits. Fat cells, especially in the belly, release inflammatory molecules called cytokines. These molecules interfere with insulin signaling. Essentially, your body is in a state of low-level stress, and your cells start ignoring insulin. 2. Mitochondrial dysfunction. Your mitochondria are the energy factories of your cells. When they aren't functioning well, due to nutrient deficiencies, oxidative stress, or lack of movement, cells become less efficient at using glucose. This inefficiency contributes directly to insulin resistance. 3. Hormonal imbalance. Hormones like cortisol, thyroid hormones, and even sex hormones play a huge role. High stress can elevate cortisol, which raises blood sugar and makes insulin work harder. Low thyroid function slows metabolism, impairing glucose uptake. And in women, imbalanced estrogen and progesterone can worsen insulin sensitivity. 4. Gut health and microbiome. Emerging research shows that gut bacteria influence insulin sensitivity. An unhealthy gut can increase intestinal permeability, promote systemic inflammation, and disrupt glucose metabolism. This is why diet quality is so crucial, not just for calories, but for the microbial signals your body receives. 5. Lifestyle triggers. Sedentary behavior, sleep deprivation, and frequent snacking all exacerbate insulin resistance. Even small lifestyle shifts, when applied consistently, can significantly improve how your cells respond to insulin. This is where it gets interesting. Insulin resistance is reversible. It's not permanent. By addressing these key drivers systematically, your body can regain sensitivity. And that's what we're going to focus on next. So, how do we translate this science into real life? Nutrition first. Focus on whole, minimally processed foods that stabilize blood sugar. Think fiber-rich vegetables, moderate protein, and healthy fats. Timing matters too. Extended periods between meals, or even intermittent fasting, can help cells reset their insulin sensitivity. Movement matters. Both resistance training and aerobic exercise improve insulin sensitivity. Resistance training builds muscle, which acts as a glucose sink, pulling sugar out of the blood. Aerobic movement enhances mitochondrial efficiency, helping your cells use glucose effectively. Stress management. Chronic stress keeps cortisol high, which drives insulin resistance. Techniques like mindful breathing, meditation, and even regular nature walks can make a real difference. Sleep optimization. Poor sleep disrupts multiple hormones, including insulin. Aim for 7 to 9 hours of quality sleep per night. Consistency matters more than perfection. Gut support. Include prebiotic and probiotic foods, fermented vegetables, kefir, high-fiber plants. These feed beneficial bacteria, reduce inflammation, and improve glucose metabolism. Consistency is key. Small, sustained changes outperform short bursts of extreme dieting or exercise. Your cells need time to recover, reset, and respond properly again. Now, let's talk about what not to do. Many people make the mistake of relying solely on low-carb diets or cutting calories drastically. That may lower blood sugar temporarily, but doesn't fix cellular resistance. Over-exercising without adequate recovery can also increase cortisol and worsen insulin sensitivity. And remember, if you have diabetes or other chronic conditions, it's critical to work with a healthcare provider before making major changes, especially with diet, fasting, or supplements. These strategies are safe for most healthy adults, but should always be personalized. Imagine waking up with steady energy, fewer cravings, improved mood, and a healthy waistline. Think about your long-term health, lower risk of type 2 diabetes, heart disease, and cognitive decline. Reversing insulin resistance isn't just about weight. It's about reclaiming your metabolic health, protecting your brain, and extending your vitality. Every small habit, what you eat, how you move, how you manage stress, has a ripple effect on your cells. And over time, those ripples become transformation. So here's the key takeaway. Insulin resistance is not permanent. It's a signal, a reversible condition that tells you your body needs support. By addressing inflammation, mitochondria, hormones, gut health, and lifestyle habits, you can restore your body's natural sensitivity to insulin. Start small. Be consistent and trust the process. Your cells are listening, and they can respond. If you want to dive deeper into natural strategies for hormone balance, metabolic health, and energy optimization, check out my next video where I break down the top 5 foods that actively improve insulin sensitivity. Remember, your health is a journey, and knowledge is the first step. You've got this.